Good morning, friends. I'm Dr. Pankaj Maheshwari, Senior Consultant and Chief of Urology at Fortis Hospital, Mulund. Good morning, ladies and gentlemen. Today we will be discussing how to maintain our kidney healthy. We know that kidney health is extremely important, and we also know that if kidneys don't work well, the quality and quantity of life may significantly suffer. We are born with two kidneys. These are bean shaped organs about the size of a fist, which are present towards the either side of the backbone on the back wall of the body cavity. The role of the kidney is to filter blood and produce water soluble waste in the form of urine. Now, how do kidneys work? When we look at the anatomy of the kidney, there are three important tubes in the kidney. The red tube is through which the blood comes to the kidney. Now, usually arteries carry pure blood, and when we say pure blood, we mean oxygenated blood. Yes, the renal arteries also carry oxygenated blood, but this is a blood which is mixed with water soluble wastes. So, that blood comes through the kidney. It gets filtered in this complex group of tubes, which are called as glomeruli, and then the filtered blood, the urine that is formed goes out through the collecting tubules and gets drained in the form of urine. The filtered blood goes back to the cistern through the renal vein, and the urine that is formed goes down by the two pink colored tubes that is called as ureter, gets collected in the bladder, and we pass it out every few hours when the bladder gets filled. Kidneys are important to us because they help us separate valuable nourishment from the waste products, and they help us get rid of water soluble waste from the blood. How much kidney function do we need? Now, this is extremely important. Understand that if you lose one of your kidney, your overall kidney function will remain normal. So, we will come to know about the reduction in kidney function only when more than 75% kidney functional loss has happened. Further, the kidney function keeps on changing with age. So, the function which I had at the age of 20 years, vis-a-vis which I would have at the age of 60 years, may be nearly 30% less. The main functions of kidney are to reduce water soluble waste, as we've already discussed, and these are creatinine, urea, ammonia, which happen because of metabolic activity, get removed through the kidneys. We all know the most important function of the kidney is fluid control. If you suddenly drink a lot of water, you will end up producing a lot of urine. If you do not drink adequate water or if you are exposed to excessive sunlight, your urine production will reduce. And this job is done by the kidneys. You may not be aware, but blood production or red blood cell production is also an important job done by the kidney. So if you have chronic weakness or chronic anemia, it is better to look at kidneys whether they are any source of reduced kidney function. Kidneys also play a very important role in maintaining healthy bones. So, what is kidney failure? Kidney failure is when the kidneys are unable to remove waste products and unable to secrete the hormones that are needed for our bones and blood production. The kidney failure could be acute, that is, it happens suddenly over a short period. This is usually recoverable, or it may be chronic when it happens very slowly over time, and usually this is non reversible. Who has risk of at kidney failure? All of us can develop kidney failure, and any of us can develop kidney failure if we do not take adequate precautions. But people who are most prone to kidney failure are people who have diabetes, high blood pressure, or people who take irrelevant or unindicated painkiller medications. As you know, in India, the incidence of diabetes is on a rise. Sadly, in our country, not only the incidence of diabetes is on a rise, also uncontrolled diabetes is on the rise. So, a lot of people tell me that I don't treat diabetes because I have no trouble. Please don't wait for the trouble. By the time you get trouble, the diabetes would have caused damage to multiple of your internal organs, including kidneys. Uncontrolled high blood pressure is also very common, And when you have uncontrolled blood pressure, kidneys need to sustain the higher pressure stress and get damaged. A lot of people are in the habit of taking painkiller medications without doctor's advice. Any small pain, backache, headache, they go and start taking their painkillers. But long-term unindicated painkillers also damage your kidney. So, so how do I maintain my kidneys healthy? Most importantly, have a healthy lifestyle. Eat a lot of fruits, green leafy vegetables, salads, or a healthy diet. Do regular exercise. Regular exercise is extremely important. Spend 1 hour a day with yourself. Understand that your day has only 23 hours and the extra 1 hour you need to spend on is exercise. Please give up smoking. There is no better way of spoiling your health than cigarette. Remember in 90s we had thick TVs and we were thin. Today things have reversed. So let's get back to 90s at least as far as our health is concerned. Strictly control diabetes and blood pressure. Give up smoking. Do not take over the counter drugs. Have regular checkups. Reduce stress in your life. Regular meditation is extremely important. If you develop any kidney disease, treat them on priority and on merit. So, what can be said? For a healthy kidney, have regular orgasm. No, 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 no. I don't mean by what you understand by this. What I mean is O stands for oil free food, R regular exercise, green leafy vegetables, adequate sleep, smoke free life, and meditation. So have them in your life and have a healthy life and healthy kidney. Thank you and best wishes.